All right. So, Craig, if you could introduce yourself, tell us who you are, where you came from, and your background, that would be great.
Sure. My name is Craig Smith. I'm a registered pharmacist. I live in St. Germain, Wisconsin. Originally from Sun Prairie. Went to school at UW-Madison. Got my degree in pharmacy there. And I've been practicing pharmacy for about 30 years, a little more than 30 years, mostly retail, some hospital, and mostly community-based retail pharmacy. Married and have 5 children. And yeah, love it in the Northwoods. And involved in helping with the Stepping On program for many years now, and enjoyed participating in that. So,
Awesome. It sounds like between the kids and the work, definitely stay busy there.
oh yeah,
Yeah. So, could you tell me a little bit about why you are passionate about falls prevention?
yeah, absolutely. Falls, especially in the elderly, can be very, very life-changing events. They can be anything from just a simple bump or bruise to a potentially life-changing event where fracture of a hip or head trauma, something really devastating can happen, especially in the elderly environment, in an elderly population. And so it's concerning to me that some of the medications that we dispense to our patients could be the cause of these kinds of falls for these people. And to me, it's just something that I really feel we can prevent through education.
Yeah, definitely. It sounds like pharmacists really do play a big role in helping to prevent some of the falls. What can pharmacists all do to help older adults reduce the risk of falling?
Well, I think the most important thing is educating the patients when they get new medications. There's many different drug medication classes that can potentially cause a risk of fall. Anything from medications that are centrally acting that can cause potential drowsiness or lightheadedness or dizziness, we call it, to medications that are not centrally acting, but work with, like, let's say, blood pressure control, these kinds of things that can cause dizziness, getting up from sitting or especially lying positions. And so when patients are prescribed medication, I think it's very important for the pharmacist to educate the patients on the risks associated with the medicines from the standpoint of, could this medication put an individual at risk of a fall? Of course, we're worried about drowsiness and driving and those kinds of things, but we also have to be cognizant of the fact that in the home environment, if the patient is on a medication, let's say to help them for sleep or mood or something like that, that they're taking in the evening, of course, that puts them at a big risk of fall if they would happen to get up to go to the restroom or whatever in the middle of the night. Being sedated by this medication could put them at a great risk of fall. So I think the pharmacists really need to be proactive in educating their patients about their medicines and the risks associated with them. Not only medications that, like I said, medications, mood altering medications, sleep medications, anxiety medications, these kinds of things that we know has the potential to cause drowsiness, but other classes of medications that people might not expect that they would put them at risk of a fall. And I think probably one of the biggest ones are the blood pressure medications, because people, if they get up too quickly from a sitting or especially lying position, like I said, can get this lightheadedness, hypotension, low blood pressure issue that causes them to get lightheaded and definitely puts them at risk of fall. So education, education, education.
Yeah, and it sounds like having an open communication, open relationship with your pharmacist is really important too.
Absolutely.
If there is one thing that you could tell your patients about the importance of reducing their falls risk and their medications, what would that be?
Well, I think to understand their medication regimen and to make sure that they're knowledgeable about the medicines that they're taking, and if there are medications that could potentially put them at risk of fall, I would hope that they would be aware. I've found in my years of practice that some patients aren't even aware of why they're taking some of their medications, and they're just not knowledgeable about the potential risks associated with them. So for a pharmacist and a patient relationship, I think it's important for the patients to make sure that they understand their medicines, why they're taking their medications, and any potential risks associated with them. That's, you know, if they're not aware of the potential risks, then obviously they're going to be at risk of a fall if their medicines can cause those kinds of risks. And so I think, you know, patients need to look to their pharmacists for good advice and education about each individual medication that they're taking to make sure that they understand any potential risks associated with them.
Definitely. And when we're talking about medications, are we just talking about prescribed medications, or what does that all include?
Well, actually, that's a great question. Some medications prescribed, obviously, those are concerns that they're going to interact with their pharmacist with, hopefully. But there are medications that are available over the counter that could potentially put them at risk, where they would not even interact with a pharmacist maybe to get those medications. They can just go into a store and purchase them off the shelf. Medications that are used for helping with sleep, the PM products like the Tylenol PMs, Advil PMs, those kinds of things have diphenhydramine in them, which is a antihistamine, generic name of Benadryl, that can definitely cause sedation. That's a PM product. Those can put people at risk. Other medications that potentially could just, you know, straight up antihistamines when they're taking medication maybe for allergy, especially this time of year, could put them at risk also, because there are still medications on the shelf over the counter that are not true non-sedating, so they're going to cause some drowsiness in these patients. And so, yeah, there's other medicines besides just the prescription medicines that can put them at risk of fall for sure. Good
Okay.
question.
Yeah, that's great to hear. So definitely keep an open communication with your pharmacist and make sure you're talking to your provider about the medications you're on, understanding why you're on those medications and what the risks are is very important.
Absolutely.
Awesome. Well, thank you so much, Craig. I really appreciate you taking the time to explain some of this.
Yeah, you're very welcome. I appreciate the opportunity.